Welcome. My name is Brian Podolak with ClinicalCorp. ClinicalCorp is a physician partner. We partner with physicians to help them with many problems, but the main one we want to speak today is increase of revenue. While the cost of living increases every year, we have found over 70% of physicians have been affected by either a decline in compensation or a lack of increase in compensation. And if the compensation isn't increasing in today's economy, in reality, you're falling behind. Many doctors have been affected by changes recently by Obamacare, insurance companies changing payouts, and etc. Now the question we have to ask physicians is, what solution can we provide that continues to help in delivering exceptional patient care, but at the same time increases revenue? Well, we have a solution. Now, in choosing a partner like us, we feel there should be 5 main points to be considered. Let's review those one by one. The first one is quality patient care. Number 2 is legal compliance. 3 is increase of revenue. Number 4, provider of ancillary services. And number 5, outstanding support. Now let's begin with number 1, which is quality patient care. Some prominent publications have recently focused on the fact that patients wish their doctors knew more about their history and the symptoms. Part of our mission is to help to provide a higher quality of care for patients. We know when patients come in to see physicians, they may not talk about all of the symptoms they are having. They may forget or not think that they're relevant. With the short form we provide for the patients to fill out, issues will be brought to light that may not have been previously discussed. Now, in speaking of legal compliance, we know that legal compliance in all of these matters cannot be treated lightly. Therefore, we have chosen Trenum Kemker, a law firm with over 40 years experience of practicing law and one of the most well-respected healthcare law firms in the country. We've spent over 7 figures with them to go over a model and are happy to report that every physician we employ will receive compensation that's fully compliant with the Stark laws, anti-kickback laws, Sunshine Act statutes, and the Patient Brokerage Act. And all data being collected has been reviewed by them and is 100% HIPAA compliant. Now, in case you've not had a chance to review that opinion letter, you'll note here on page 2, in the second paragraph, that the physicians that we employ must be in a position to refer patients. So in other words, the data we're looking for must have prescriptions with it. Otherwise, we would not have relevant data. However, for the physician, this is great. For example, if they submit 100 surveys, and let's say they submitted 100 prescriptions, even if only 20 to 40% adjudicated, you would still be compensated for the full 100 surveys, or $5,000. Now, talking about increase of revenue, let's see how this patient survey program actually works. So, if you don't have a copy of the survey in front of you, we will get you one. But you will know that the survey has a lot of pertinent information collected from the patient. Remember when we discussed patients not disclosing all of their symptoms? This short form we provide will help you uncover any pain they may be experiencing. You may have noticed there's a checkbox at the bottom of the survey where the patient asks to try an alternative or additional treatment. We believe our solution will fulfill this desire for a non-addictive pain treatment. With this one form, we have started the discussion of symptoms, but have also offered a treatment plan. Now, the time required to upload the data that we need from this survey is what we call a survey cycle. Now, the time needed to take the data and upload it to our system, the average time is only between 1 and 2 minutes of a physician or their staff's time. But even though it's only 1 or 2 minutes, we compensate physicians at that usual and customary rate of $200 an hour in increments of 15 minutes. Therefore, one survey properly uploaded is worth $50 for just 1 or 2 minutes of the staff's time. Now, we think that most doctors that join our program have at least 5 patients a day who would meet the following criteria: ages of 18 to 64, have private insurance, TRICARE or Workman's Comp, and suffer from some type of pain that a cream will apply for, as we'll see in a minute. If a physician only has those 5 patients a day, they're earning $5,400 a month, or over $60,000 a year. And that's just for our first survey. So let's review this process just a little more. After reviewing that patient survey we saw earlier, a physician would simply review the reference sheet as chosen here and choose the appropriate formula. So let's say the patient had diabetic neuropathy and the physician felt that the product number 2, the FGN-PLC, would be the best course of treatment for that patient. After noting that, they would simply switch to their customized script pad, select number 2, sign, date it, and fax it into the network of over 33 pharmacies who contact the patient usually within 2 hours. Next, the physician needs to submit the survey to be eligible for the compensation. After logging in, they would click on the activity log tab, thank you for that, and then note that the log is pre-populated with the practice's information. The survey date will default to today's date. Then there's a drop-down box for the sex of the patient, a quick calendar to choose the date of birth, the ICD-10 code, and they will be sent a decoder, then just the email or phone number for identifying information, and then check one of the boxes to let us know if it's accompanied by a script or not, and click Add. If you actually had the 5 surveys in front of you, and you did all 5 at one time, it usually takes 3 to 5 minutes once you've done it a few times. Now, this also acts as the invoice. There is no paperwork. There's nothing else a physician needs to do to be able to be paid. So now we could see how just 5 minutes of the staff's time turns into over $250 for that one day and puts the physician on track for a $5,000 month. More surveys do mean more revenue. Now, what other ancillary services can we assist the physician's office with? Well, a secondary and most common one is weight loss. We have a very large issue in America, and that is obesity. Now, many patients are overweight and need help to start the process to get into shape. In fact, we have studies that show over 68% of Americans are overweight. Now, we all know that obesity increases the risk of many health conditions and diseases. And after a physician participates with us between 1 and 2 months, they may elect to participate in this protocol. Very similar, again, earning $50 per survey, plus the added benefit of additional patient visits, and at the same time, helping that patient to lose weight. And of course, outstanding support. We have dedicated physician representatives to visit the office and to help you get started in the process. We have pharmacists on call. They answer any questions related to pharmaceuticals, medical directors to answer clinical questions, IT staff, and so on and so forth. The very next steps to begin is to contact us or to speak to your rep who's with you today. They will bring out 5 script pads and 5 surveys right now. You can start collecting the data, sending in the scripts, and schedule with them training hopefully within the next 2 days. If we were able to make it out there in the next 48 hours, you should have those 5 surveys and 4 or 5 scripts done. That way, in the day of training, you've just earned $250, and it usually takes 10 or 15 minutes. So go ahead and speak to your rep and schedule that training for the next day or 2.